5 minutes has elapsed. So now what we want to do is see exactly the whole trypsin process, if it worked. So what I'm going to do, we have some condensation here from the humidified environment, so I'll wipe that off at the bottom, because that allows us to actually see if the cells are still on the plate. So I remove this, like I said, try not to touch the inside of that. And what I'm seeing is that it's like the cells have come off. But what I'm going to do to ensure that, there's still some cells on there actually. The cells still seem to be on the plate.
It's still pretty shiny.
Yeah, you can see it. So what I'm going to do, and I can see some cells in the liquid, I usually do it like this a little bit to kind of disrupt. But what I will do now is I'm going to add the neutralizing medium, and this is actually the medium that they grow in also, so it's a perfect deal. So what we'll do, we'll neutralize it with an equal amount of trypsin. So I put 3 mils of trypsin. I will put 3 mils of this medium, and it's CO2 independent medium, because at this point we don't have a tissue culture hood that actually has CO2, so we have to use the CO2 independent medium to make these cells happy. Alright, so what I've done is taken that out. I'm going to actually put it on the plate and see if the cells come off. And we see I still see cells on here. See cells on here, so we're actually trying to figure out why we don't see a lot of cells when we trypsinize, and I think we might have figured out the problem. I don't see the cells coming off. Well, I actually do see some coming off. So to encourage them to come off, or to get them to come off, you have to actually pipette multiple times. I still can see a good number of cells on here, and I think I actually figured out the problem. The cells seem, with that trypsin, they don't want to come off. So what I'll do, I'll take this up, and we're going to try this process again with trypsin that I actually brought from my lab to see, because when you trypsinize the cells, there should be cloudiness that indicates that the cells have actually come off the plate. I don't really see that. So what we're going to do, we're going to actually take the rest of this off, and I'm going to use my trypsin and see if there's something wrong with the trypsin. Abraham, how long did you have that trypsin?
How long?
Yeah, how long is that?
We bought it in November.
Okay, so I'm going to try this whole process with my trypsin that I brought from our lab. Alright, so sterile technique again. I'll wipe off, put a couple of drops on there, wipe that off. So I did transport it, so I want to make sure that's sterile. We'll do here, we'll try this process again, because I think we figured out why we're not getting a lot of cells, because the cells seem like they're still attached to the plate. Alright, so we'll do that, put it back, and we will wait another 5 minutes and see what we see.